All right, welcome back, everybody, and good morning to those of you who are just logging in or just sitting in front of your television sets. This is the Now Morning Show right here on TTT, also on Talk City 91.1 FM. If you just jumped into your car to take on the nation's roadways, I hope you have it on the right station, which is Talk City 91.1. And to all of you, wherever you are in the world, on Facebook, looking at us at the Now Morning Show Facebook page, good morning or good evening or whatever time zone you're in. Greetings to you as well. Happy that you are watching us this morning. Now, as I mentioned, we will be chatting this morning with Dr. Erica Wheeler. She is the PAHO and the WHO country representative, Trinidad and Tobago, and the Dutch Kingdom Islands. We are discussing living in the time of COVID, and we are speaking of new cases and a possible second wave, the way forward here in Trinidad and Tobago. Good morning, Dr. Wheeler. Welcome.
Good morning, Carrie. Thank you for having me.
And thank you for joining us. And it's always a pleasure having you here because you are such a wellspring of knowledge when it comes to the ways in which, about the pandemic itself and so much more, and the ways in which we could possibly move forward from that. So the first thing in the topic is that, we have some new cases here in Trinidad and Tobago. Dr. Wheeler, can you hear me?
Yes, we know that there was a incoming cruise ship and that this was planned for and that there are 6 new cases. But please remember, these cases are imported and the persons who were testing positive were confined to the cruise ship and not in contact with the general public.
Which is good news because, when people hear of new cases, some people may get a little worried and think to themselves, well, are we going to go back into lockdown? And, we had just begun seeing the release of certain lockdown measures. So is there anything from where you sit, is there anything that at this point the country needs to worry about? Would we possibly have to revert any of the measures?
No, at this stage, Carrie, we are not in a situation where we need to reverse measures for the simple reason that the persons who tested positive, they came in, they were confined, they were controlled when they were tested. There is no need for contact tracing because they did not come into contact with the general public. So it's not as previously when the persons came back from the cruise ship and some persons actually were in contact with others. In this case, they were kept in a confined space. Even now, the remaining persons on the ship, the government is in control of where they are and of their health status. And also, the 6 persons who tested positive were carried to the hospital in such a manner that again they were not exposed to the general population. So this has been organized. The return of these nationals were carefully organized and supervised. So they have had no contact with the general population. So this does not represent a second wave. There is no contact with the general population. So no need to worry.
And I'm sure a lot of people can breathe a sigh of relief, when they hear information like that. Now, there are quite a number of nationals who are either on cruise ships waiting to get into the country, and there are a number of nationals who live abroad that have also requested to come back home, being that our situation here is much better than many of the other countries in the world. Now, we do know that the government is taking a measured approach to how many people and the rate at which they can come back home to Trinidad and Tobago. How much do you think would be too much? Is there any possibility of overwhelming our system if if the numbers get too high? And is it that, for instance, if there are a number of nationals, let's say, for instance, on that cruise ship, who have the virus, but they may not know, are they at risk of getting very, very ill before they're even discovered to have the virus?
Okay, so let me start with the last question first. The quarantine period is 14 days. So if there are persons on the ship who did not test positive at the time they were tested, within the next 14 days, we would expect to see those persons becoming ill. And that would flag to the government that there's a need to take action. My understanding is that they are spread out on the ship in such a way that they don't come into contact with others. And presently, there is room at Cora, at Cova, to be able to accommodate people who need to be accommodated. No one so far is in an ICU unit or a high dependency unit of the persons that have come in. So, in this sense, with the 6 persons, of course, there's no danger of overwhelming the system. And because of how they're being treated on the ship, there's minimum exposure to anyone. I understand that their food is brought to them, but of course, it would be in conditions where the persons bringing that food would not be affected.
Right.
So on the ship, it does not appear to be any danger. Now, in terms of overwhelming the system, of course, if everyone who wanted to come back at the same time were allowed to come back, there would be a danger that the numbers of persons testing positive and needing care um, could overwhelm the system if everyone came back, because the what the government calls the parallel health system cannot accommodate thousands of persons, because remember, we have different levels of care. We have
Right.
the step down facilities and the isolation facilities, and then the hospitals, and within the hospitals the severe units. Normally only 5% of cases need intensive care, but at this stage, the government has to be extremely careful about bringing back too many people that the health system would not be able to accommodate should larger numbers of persons, more than 6. In fact, they would be very mindful that they need to have a situation where at least 75% occupancy we would see at hospitals. Above that, it means that they would be in danger of overwhelming the system. But that would only happen if very large numbers of persons came back very quickly into the country in an uncontrolled manner.
Definitely, definitely. And you spoke of the individuals on the cruise ship. I want to go back to that topic itself because something just crossed my mind. There would be those who are providing services for those individuals on the cruise ship, those who would bring them food. I'm sure there would be medical staff who's there to observe and monitor the individuals on the ship as well. From your knowledge, are those individuals also made to stay on the ship and have no contact with the outside for the time being, or is it that they are allowed to go home to their families and they are allowed to go amongst other people as well?
Okay, now I don't know the answer to that. I don't know how the government is treating with those persons on board the ship, but um, from the perspective of WHO and PAHO, those persons would have to be, those who are serving the persons on board naturally would have to have proper protective equipment. Now, remember, in hospitals, nurses and doctors who take care of persons who have been tested positive with COVID 19, they go home to their families.
Right.
They are protected, they have their personal protective equipment, they have to follow all the infection prevention and control guidelines so that they themselves don't become infected. And we know that thus far in Trinidad, thank God, there have not been cases of health professionals becoming ill or, as in other countries, dying. So, not because you may serve someone on board a ship who has not, remember, they have not tested positive,
Right.
but precautions would be taken. It is not automatic that they should be separated from their families if proper infection prevention and control measures are followed. That is very key for those persons as well as any medical persons who will be observing them while they see if those on the ship develop any other symptoms. But thus far, they have not tested positive.
Which is great news, of course. Well, I want to see the flip side of that because you mentioned that we do have medical professionals, doctors, nurses that would have been dealing with and treating with patients who had tested positive, but they did not carry home the disease to their families and loved ones. You know, and we have seen in other countries where that has not been the case, that they actually have. What are we doing right here in Trinidad and Tobago?
So what we are doing right is providing healthcare professionals with the proper personal protective equipment. This means that they have the right surgical masks, they have what's called N95 masks, and the number 95 is significant because it means it prevents 95% of microbes from getting through the mask. But in addition, they've got face shields, they've got gloves, they've got gowns, so they have all of the proper personal protective equipment, which of course has to be changed regularly, because if you are dealing with patients with COVID-19, which is highly contagious, you have to have sufficient supplies of personal protective equipment. So we have heard stories of in other countries where health workers have been making up their own, doing DIY for their personal protective equipment, sometimes even using garbage bags. We in Trinidad don't have that situation. And in addition to having the face shields and the mask, there are also goggles that they have. So they have
Wow.
all of the equipment that they need to take care of patients in a way that protects them from becoming infected. So I would say that is the main thing: the personal protective equipment, an adequate supply, proper use as well, in terms of how do you put on and how do you take off the masks and so on, and how often you discard your personal protective equipment.
All right. So currently in the country, we have this measure of no mask, no service. And you mentioned before the N95 mask being um, the medical grade mask, which stops 95% of bacteria and organisms and such. But in most cases here, the general public would use like a fabric mask or anything along those lines. When it comes to the protection from the disease, how efficient are these fabric masks at helping, being that they're not medical grade?
Well, WHO initially did not recommend the use of cloth masks, but there was a recognition that countries across the world, in an effort to stem the tide of the spread, were suggesting to their citizens that they use cloth masks. WHO has recently put out directives on the use of masks in general, um, and we have said that medical masks must still be worn by people in the community who are taking care of those who are ill. uh, on the subject of cloth masks, we have put out some directives because, understandably, some types of fabric are more porous than others,
Right.
and the mask is not meant to protect it's meant to protect others from you in case you cough or you sneeze. So this is why, if you are wearing a cloth mask, it is so very critical that you observe all of the other hygiene measures. Wearing a cloth mask alone, as it has been said by the government also, does not protect you. You have to keep washing your hands. If they're dirty, using hand sanitizer, observing all the cough and sneeze etiquette. But we have indeed put out new guidance as of this month on the use of cloth masks, but we are still saying, as WHO and PAHO, that medical masks should be reserved for health professionals and they should not be worn in the community by citizens. But globally, we have seen that many persons have been wearing other types of fabric coverings. So we have put out guidance, but the science shows that the surgical masks and the N95 masks, which health professionals wear, are the most efficient masks as of protecting from the wearer from contracting COVID-19.
Doctor, there have been cases where, you know, one person in a family living in the same household had tested positive, but the others had not tested positive. being that they live in close quarters, how is this even possible that they didn't all become infected?
Well, that depends entirely on the how, uh, without knowing the circumstances of how that person who contracted it was interacting with others. It's difficult to say. But for example, if you have someone in a family who has COVID-19, if they are not mixing, if they don't transmit the virus by coughing or sneezing on others within a distance, a minimum distance of 3 feet, and if they observe proper personal hygiene, then it is possible. It is also dependent on the level of immunity of the members of the household. So one would
Right,
really have to have more information on the situation of this family. If they were able to physically distance, they had that capacity within their household so that they don't come into regular contact with other members of the household, and that all the dishes and so on that they use were separate and there was a high level of hygiene in the house, then it would decrease the chances of the other members of the household contracting COVID-19. Because remember, we always have to come back to how is it spread?
right,
It is spread by droplets primarily.
right.
So if the droplets don't get on other persons and those persons don't touch and they have good hygiene and they don't touch their eyes, mouth, and nose, then it would decrease the likelihood. That, together with, as I said, it depends on the level of immunity, the ages, and whether other members of the family had any underlying health issues,
Right,
because we have seen that these are some of the factors which increase the level of which people can become infected.
right.
So more information would be needed, but you get my drift in
Yes,
terms of how it is actually possible.
yes, definitely. And adding to that, before my last question this morning for you, Dr. Wheeler, adding to that, what steps can we take, for us, people who live with other people in the household and stuff? What are some of the tips we can do even on a regular? We don't have local or community spread at this point, but of course, prevention is better than cure because you never know. Um, what tips can you give us to in this time of COVID, for those living in close quarters? What steps can we take to ensure that we are continually protected from, well, each other, really?
Yes, yes. That's important because not everyone is in a situation where they can maybe constantly physically distance. But you have to remember that this virus, the outer coat of it is quite fragile. And this is why we constantly recommend that people wash their hands frequently and that they use sanitizers after they touch surfaces. Because I think it is part of relearning certain habits
Right.
when we live with others now. Even if you occasionally and you have to come into quarters in terms of less than 3 feet from others, if you do observe your personal hygiene and you become more conscious, I think we have to train our minds now to be more conscious about washing our hands, about not touching our faces. That is really critical.
Definitely.
I do it without sometimes realizing it. And then you think, oh my goodness, you wash your hands, you sanitize your hands, you be careful about, the surfaces you touch, and then you're recommended to now. And this time it is rather unfortunate that we don't engage in the hugging and the kissing, that
I
sort
know.
of thing. It might be less dangerous with members of your family, but if you're someone you have a job and you are moving in and out of the household, you have to be very cautious about how you interact with persons in your household from now on. This is part of what we're calling the new normal. We have to change our habits for the future. And yes, we don't have community spread now, but I would say raising the level of awareness of personal hygiene, about environmental hygiene, keeping the hand sanitizers, the wipes, making sure that you clean your home properly with the right level of products that can actually kill the virus, which, as I said, is quite fragile. the combination of the environmental hygiene, the personal hygiene, and the cough etiquette is going to remain an important part of our lives because we still don't have a treatment and we still don't have a vaccine.
That's right. And with that, I want to thank you, Dr. Wheeler, for joining us this morning. And it's always a pleasure having you with us because you give us such useful nuggets of information and education, on how we can all do our part to help stay safe and to help battle the coronavirus itself. So I want to thank you, Dr. Erica Wheeler.
Thank you, Kerry.
All right, so I was just chatting there with Dr. Erica Wheeler, who is the PAHO and WHO country representative, Trinidad and Tobago and the Dutch Kingdom Islands. All right, we're going to take a little bit of a break and we're going to come back with much more, so stay right where you are.